Welcome to this introduction to child and adolescent psychiatric research. The first question, of course, is why is it so important to do research in child and adolescent psychiatry? The main answer could be research is important for advancement of knowledge in general and in medicine in particular. But this is not the main answer. In fact, the main answer is that research is important for your patients. When you are a clinician, you need to determine a diagnosis, a treatment, and a prognosis. And research is a key point to provide reliable prognosis, diagnosis, and treatments. We have to evaluate our treatments, we have to refine our diagnosis, and we have to do clinical research and epidemiological research for that. There is a third point which is very crucial about research in child and adolescent psychiatry. Research is important for you. Indeed, when you are a clinician, regularly you have to step back from your practice. Why? Because when you are involved all the day with patients, at the end you are likely to reproduce always the same error. This is a real risk. And research is very important to challenge clinicians potentially in their error. What do you need to do research? To do research, you need above all some time. Indeed, time definitely do not pass at the same speed when you do your clinical work and when you do research. When you do your clinical work, sometimes you have only 15 minutes, 30 minutes to deal with an important problem. When you do research, regularly you will spend one full day, one full week for a unique and simple question. To evitate to lose your time, which is very valuable for research, you have to focus on two very important points. The first one is a research question. You need to determine a very good research question. And the second is to stay in the good direction during your research. You will have a certain tendency, most often, when you involve yourself in a research, to go in many directions, even to change direction from time to time, and even to change your research question. And after 1, 2, or 3 years, you will have the feeling to be lost, to have done nothing very concrete. To struggle against that, there are two key points. First, mentorship. You have to find a mentor that will direct you in the good direction, and you will have to work with a research team that will support you from time to time, colleagues and friends, other students with whom you will be able to discuss about your research question. And of course, a research network like the research network proposed by IACAPAP can be an important tool for that. It is classical to say that to do research you need some money. And to be honest, this is true. You need money to evaluate patients, to monitor the clinician, to do statistical analysis, to go to Congress, to write paper, etc. Indeed, if you have a grant to do your research will likely be more professional and will be of a higher standard. But even if you have no money, you can do research if you are a clinician. If you are in contact of patients, even with small samples, you will be able to do good research and to publish it in international journals. There are two personality traits which are important for a researcher. The first one is perfectionism. And sometimes clinicians do not need to be perfectionists. You know, when you are a clinician, you have to be very efficient in a short period of time. When you are a scientist, you have to take time and to do something which are very precise, very clean, very reliable. You need also to have intellectual honesty. And this is also a quality that should have clinicians. When you are a scientist, you need to be highly criticized with yourself. All the time you have to ask yourself, I think that I did this hypothesis, but perhaps this is not true. I do this interpretation, but perhaps this is not the correct interpretation. You need critics about yourself, because other researchers will critique your work and you have to anticipate this. Of course, there is one thing which is absolutely mandatory. This corresponds to regulatory issues. You have to propose your protocol to ethics committee, to institutional review boards. You have to take into consideration the notion of confidentiality of your interviews. You have to secure the participation of your patients. In most of countries today, this is something which is completely inescapable. Most of the time, you will have to use statistics to analyze your data. And traditionally, child and adolescent psychiatrists or psychologists are a little bit scared about statistics. And they are wrong with that, because statistics are a friend of the researcher. Statistics is a kind of language that helps to structure the methodological way of thinking. Perhaps you will have the temptation to give your data to a statistician so that he or she will analyze this data. You shouldn't do that. You should analyze your own data. This is the best way to understand what is behind your data and to deal at best with your interpretation. And the good news is that today you have very efficient statistical software which are free, like the software R, the letter R. It is a wonderful software, a little bit tricky to use, but very efficient, and it is free. And second, now on the internet, you have many training resources about how to learn statistics in practice. Once your research work is over, you have now to communicate it to other researchers. This is crucial because research is based on exchange of knowledge between all researchers. To communicate your results, you can go to Congress, you can propose poster, you can propose oral presentation with slides, and of course you can write scientific papers in peer-reviewed journals. This is a particular knowledge, writing papers, slides or papers, this is a particular knowledge and you will have to learn it, but this is another story.